Good evening, and thank you for joining us. I'm Dr. Linda Scott, Dean at the University of Wisconsin-Madison School of Nursing. It is my pleasure to welcome you this evening on the final day of Nurses Week and on the birthday of Florence Nightingale. Our audience this evening represents individuals whose professional roles and personal convictions are related to health, healthcare, and advancing well-being. In celebration of nurses, our collaborators, and others who contribute to the profession, I wish you all a happy Nurses Week. We are here because we want to maximize the positive impact on health and health equity that can be made through the nursing profession. It is a pleasure to gather in this spirit. Before I introduce Dr. Hassmiller, I would like to begin our program with a land acknowledgement. It is relevant to the origin and persistence of health inequities in the Native American and Indigenous populations. The physical campus of UW-Madison on the shore of Lake Mendota in Madison, Wisconsin, is on land that originally belonged to the indigenous Ho-Chunk people. Today, we respect the history, culture, and inherent sovereignty of the Ho-Chunk Nation and the 11 other members of the First Nations of Wisconsin. We value the continued presence and contributions of Indigenous people to the university, communities across the state, and to all of society. As we consider issues of health, health equity, inclusive research, culturally congruent care, and more, we do so with mindfulness of our shared history. And we should let this knowledge inform our approaches to meeting health needs in the future of nursing. Tonight, we are fortunate for the opportunity to learn about the recommendations for the future of nursing, which will help us chart a path for health equity. It is my pleasure to introduce our guest for this evening, Dr. Susan Hassmiller. Dr. Hassmiller serves as the Senior Scholar in Residence and Senior Advisor to the President on Nursing at the National Academy of Medicine. In this role, she is a key member of the leadership team for the newly released report, Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity. Dr. Hassmiller is also the Robert Wood Johnson Foundation Senior Advisor for Nursing, and in partnership with the AARP, she directs the Foundation's Future of Nursing Campaign for Action. This nationwide initiative has advanced the recommendations of the National Academy of Medicine's first report on the future of nursing, Leading Change, Advancing Health, released in 2011. Dr. Hassmiller served as the study director for that report. With the release of the 2020-2030 report, the Campaign for Action's important work will continue under Dr. Hassmiller's directorship. The campaign's focus will be on implementing the report's recommendations, about which she will speak tonight. Dr. Hassmiller has a professional career that has included service in public health settings at the local, state, and national level, including the Health Resources and Services Administration. As a nurse educator, she has taught community health nursing at the University of Nebraska and George Mason University in Virginia. Dr. Hassmiller is an elected member of the National Academy of Medicine, a fellow in the American Academy of Nursing, and sits on other advisory committees and boards. She is the recipient of numerous awards and 4 honorary doctorates. Most notably, Dr. Hassmiller is the recipient of the Florence Nightingale Medal, the highest international honor given to a nurse by the International Committee of the Red Cross. Over the next 40 minutes, Dr. Hassmiller will present an overview of the recommendations made in the newly released Future of Nursing report. Following her presentation, I will join her on screen to share some of your questions and comments that are asked via the chat feature. And now it is my pleasure to invite Dr. Hassmiller to begin. Sue, the floor is yours.
Thank you. Thank you very much. It is an honor to be with you tonight. Dr. Scott wanted to be the first one out of the gate after we released the report yesterday. and we kept close tabs on when that release would be. May 12th, you are the first ones to hear this, other than the about 8,000 people who were on the line yesterday with the report release. So I'm incredibly grateful to Dean Scott for her stellar leadership, for inviting me to be with you tonight, and thanks to each of you for your dedication and commitment to nursing, whether it's serving on the front lines, teaching the next generation of nursing leaders and researchers, conducting research yourself, or preparing to enter the nursing field. I'm thrilled to present to you for the first time the findings from the National Academy of Medicine report, The Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity. The report arrives at an inflection point for the nursing profession. This past year has increased our visibility. I think everyone knows that, but it comes at a great cost. Nurses are emotionally spent from caring for COVID patients. The pandemic has also laid bare the stark inequities that have been persistent across generations. The decade ahead will demand a stronger, more diversified nursing workforce that is prepared to provide care, promote health and well-being among nurses, individuals, and communities, and address systemic inequities that have fueled wide and persistent health disparities in this country. The University of Wisconsin Madison School of Nursing will help to usher in that future. This report is aspirational and ambitious. I'm incredibly proud of the committee that I worked with that oversaw the creation of the report, led by Drs. Williams and Mary Wakefield. It recognizes that nurses can play a central role in advancing health equity while acknowledging that nurses need robust education, supportive work environments, and autonomy. Next slide, please. This report is the second major report released by the National Academy of Medicine on the future of nursing. The first report, The Future of Nursing, Leading Change, Advancing Health, released in 2011, reconceptualized the role of nurses in transforming our healthcare system. The Robert Wood Johnson Foundation then, with AARP, formed the Future of Nursing Campaign for Action, a nationwide initiative to advance the report recommendation initiative that I direct. The nursing field, including many of you, mobilized to strengthen nursing education, advance practice, promote nursing leadership, and increase workforce diversity. Everybody worked to make what happened over the last 10 years happen. Together, we built the capacity of the nursing workforce to expand high-quality care to more Americans. The new report that I'll discuss tonight builds on the gains that we have made and seeks to leverage our capacity to now advance health equity. Next slide, please. As the nursing field built its capacity, we started to ask, all right, to what end? I know that we have to keep building capacity, but now that we're here, to what end are we going to use this capacity? We knew that stark health inequities existed in the United States, and we also knew that nurses have a long history in tackling the many social and economic drivers that affect health. Nurses are the largest and most trusted segment of the healthcare workforce. They work in a range of settings, and they are often the first and most frequent contact with individuals, families, and communities. In 2019, the Robert Wood Johnson Foundation asked the National Academy of Medicine to chart a path now for the nursing profession to create a culture of health, reduce health inequities, and improve the health and well-being of this nation. The National Academy of Medicine formed a committee to release a consensus report in December 2020. While the committee was in the midst of writing the report, however, guess what happened? The pandemic, followed by renewed calls for racial justice. And we realized that the only way for this report to be relevant was to delay its release, to incorporate the lessons of the pandemic, the devastating toll it has taken on nurses, and the ever-growing calls for racial justice. The report is being released during a critical time in our nation's history and in nursing. when it's clear we must dismantle structural racism to eliminate injustice and these inequities. Nursing needs to be at the forefront of creating a more fair and just world, and we need policy reforms to unleash our own potential. The report's vision is audacious. The achievement of health equity in the United States built on strengthened nursing capacity and expertise. Next slide, please. Achieving health equity is the most salient issue of our time. I'm going to say that again. Achieving health equity is the most salient issue of our time. And it is nursing's time to help lead the charge. I believe this. As a country, we have long failed to give everyone a fair and just opportunity for health. We know that health is greatly influenced by non-medical factors that affect communities, such as access to jobs that pay a living wage, safe housing, reliable transportation, walkable neighborhoods, good schools, fresh food, and adequate green spaces. Just think if you did not have those things in your life, how it would make you feel. Factors like our race and ethnicity, income level, sexual orientation, disabilities, and the conditions where we live, including in rural and remote areas, predict whether we will suffer from preventable, costly medical conditions, live shorter lives, and have a fair and just opportunity to be as healthy as possible. Next slide, please. Compared to whites, Blacks and Latinos are more likely to live in neighborhoods that lack healthy food options, green spaces, places to exercise, safety, and have more pollution, all the things that I just mentioned a minute ago. This is due to structural racism, defined as a system in which public policies, institutional practices, cultural representations, and other norms of work in various, often reinforcing ways to perpetuate racial group inequity. Right here in Madison, I should say right there in Madison, many of your neighborhoods that Black people live in originated in the early 1930s due to redlining. What is redlining? Deliberate policies that kept Blacks restricted to certain areas of a community that lacks social and economic resources. That's a prime reason for many of the health inequities in Madison today. Madison, however, is in no way unique. This happened throughout the United States. Next slide, please. These structural inequities and the stress from experienced racism lead to poorer health and mental health. Blacks and Indigenous people, for example, experience more chronic health conditions sooner, which also puts them at higher risk for COVID. Next slide, please. The effects of the pandemic on health and income have been especially severe for low-income individuals and people of color. Low-income individuals and people of color are more likely to live in crowded housing, take public transportation to work, and be essential workers. They are also more likely to lack health insurance and have access to care. Consequently, they cannot follow recommended social distancing guidelines as easily. And that's why they have been affected more disproportionately by the pandemic. Next slide. And here's another thing. The brutal killings last year of George Floyd and Breonna Taylor by police officers and Ahmaud Arbery by white men while running, and the unconscionable long list of Black and Latino victims who preceded them and came after them, as well as the over 3,800 reports of hate crimes and incidents against Asian Americans and Pacific Islanders this past year. All of this underscores the need to adequately acknowledge, confront, and dismantle systems of structural racism, including within our own profession. Next slide. This report is intended to meet this moment. It contains 4 messages, has a lot of messages actually, but I will highlight 4 messages, and a series of recommendations to unleash the potential for nurses to achieve health equity. These recommendations are the consensus of the committee based on the evidence. RWJF is still reading and digesting the report. Next slide, please. The report calls on the systems that educate, pay, and employ nurses to permanently remove barriers to allow them to do this work, value their contributions, prepare nurses to tackle and understand health equity, and fully support them. They need to dismantle structural racism and diversify the nursing workforce. The need to dismantle structural racism and diversify the nursing workforce is woven throughout. And I'm going to discuss each of these now. Next slide, please. Many people in our country can't access healthcare because they lack insurance, the ability to pay, and clinics or providers in their geographical area, particularly in rural and urban areas. Nurses can help to bridge the gap in access to care through their work at federally qualified health settings, retail clinics, home health and home visiting, telehealth, school nursing, and a school-based health centers and nurse-managed health centers. About 70 to 80% of all advanced practice RNs work in primary care, in pediatrics, adult health, gerontology, and also nurse midwifery. The nurse practitioner field has grown considerably, while the number of physicians going into primary care has remained stagnant or has declined. Studies have repeatedly demonstrated that nurse practitioners provide care that is equivalent to the care provided by physicians. We are still talking about this, ladies and gentlemen. Nurse practitioners are 10 to 30% less expensive to employ than physicians and are more likely to care for non-white, non-English speaking Medicare and Medicaid beneficiaries, including those in rural areas, at a lower cost of care. And all nurses can improve the quality of health care by managing and coordinating care and providing support during care transitions, such as when people are discharged from the hospital and return home. However, the ability of nurses to practice fully in these and other settings is still limited by state and federal laws, institutional barriers, and restrictive health system policies where they work that prohibits nursing from working to the full extent of their education and training. Next slide, please. The report calls for all organizations, including state and federal entities and employing organizations, to enable nurses to practice to the full extent of their education and training by removing regulatory and public and private payment limitations and restrictive policies and practices. This recommendation continues the work of the first report. While we've made considerable progress over the past decade in lifting state level regulations restricting nurse practitioner scope of practice, 27 states, guess what, including Wisconsin, still do not allow full practice authority for nurse practitioners. Not permitting nurses to practice to the full extent of their license and education decreases the types and amounts of healthcare services that can be provided for people who need care. Until all nurses are permitted to practice to the full extent, significant and preventable gaps in access to care will continue, and this all affects health equity. That's why the committee decided to really re-emphasize this recommendation again. Millions of people who need health care will be unable to obtain it as readily as others who happen to live in states where nurse practitioner scope of practice is unrestricted. For many people, delays in obtaining care to worsening of symptoms and disease progression and to greater costs when people ultimately receive care. And I will tell you that we are not at a tipping point with this one. California, I always said, if we can get California full practice authority, then some of the other states will happen. California went partial full practice authority, and we still have a long ways to go. Okay, so next slide, we are on number 2, valuing nurses' contributions. Nurses engage and connect with individuals, communities, public health, and healthcare and social service organizations to improve health for all. A good example is how nurses can screen patients for social needs and create care plans based on those needs. They then refer patients to appropriate professionals and social services. and coordinate care with social workers, community health workers, social service providers, and folks in other sectors. However, the current payment systems are not designed to pay for services that address social and economic drivers of health and advance health equity. As a result, they often do not explicitly value nurses' contributions to care. Payment systems can enable nurses to make essential contributions to improving care and outcomes for all patients when they support team-based care, improve communication between providers and patients, and proven interventions and strategies that can reduce health inequities. Nursing roles to advance health equity will only be scaled up if they are valued and paid for. Public and private payment systems should be intentionally designed to support and incentivize healthcare and public health organizations to enable nurses to perform these roles. New payment models, such as accountable care organizations, accountable health communities, and value-based payment, can give health organizations the flexibility to address social needs and advance health equity. I wanted to mention, something else that's not here. So we all know this is my first time out of the gate doing all these things, and so things are coming into my head. So let me mention one thing that the committee recommended, as well as an overhaul of the payment system. Of course, they recommended that our nation institute a national nurse identifier system. And physicians have this, all physicians have numbers. And in this way, we can track the care given by individuals, physicians, and physicians can be accountable for that care. So we're offering that recommendation, that recommendation for nurses as well. And until nurses can be individually called out and accounted for, then they'll never really have, their care valued in the way that we think it should be. Let me just say that. Okay, next slide, number 3, preparing nurses to tackle and understand health equity. The next 2 key messages are particularly relevant for this audience. We need to do a much better job of educating nursing students so they are prepared to promote health equity and improve the health and well-being for everyone. Students need to be better prepared to understand and identify the complex social and environmental factors that affect health, effectively care for an aging and more diverse population, engage in new professional roles, adapt to new technologies, and collaborate with other professions and sectors, and adapt to a changing policy environment. A strengthened nursing field will be critical as baby boomer nurses retire this decade. So let me add something else that's not particularly in my notes. I want to make sure we emphasize this. In the first report, and as nursing students learn in school, it's really important to practice in an interprofessional way, have a respect for the other professions that we work with. So this report takes it up quite a few notches to say that, we're going to assume that nurses know that they need to practice interprofessionally. Now we're saying that nurses really need to understand and be comfortable working with other sectors. What do I mean by other sectors? Other sectors that represent those social determinants, like folks in the food industry and transportation, and social isolation. So we need to become very comfortable in working with those other sectors. I think public health and school nurses, they do have this comfort level, but we're calling for all nurses to be comfortable in this level. Okay, so next slide. Developing a more diverse nursing workforce will be key to advancing health equity. The new report unequivocally states that the nursing field needs to address systemic racism and bias within nursing and prioritize diversity and cultural humility. Again, something that the first report brought out, but we're not there. So we're not there, so we have to keep saying it. For too long, the nursing profession has been identified as being a caring profession and maintain an an identity of color blindness. I know myself, I was always so proud to say that I was colorblind, but learning, I will say recently in the last couple of years, that's just really not good enough. As a result of saying that we are colorblind, we've not addressed the systemic barriers that keep the nursing profession overwhelmingly white and female. Despite decades of emphasizing diversity, the nursing field remains approximately 80% white, even though whites make up 60% of the US population. So you'll note that gap. The gap widens further for nurses in leadership positions, including in academia, with about 90% of nursing leaders coming from white backgrounds. Next slide, please. The report calls on everyone who is involved in nursing education to understand that health equity is a core component of nursing. A core component of nursing. Next slide. Right now, content about the social and economic drivers of health, health inequities, and population health are not really well integrated into undergraduate and graduate education. Nursing education programs should ensure that nurses are prepared to address the social and economic drivers of health and achieve health equity. Schools of nursing need to integrate these concepts and competencies throughout their coursework. And I'm saying not just for public health and school nurses. They get it. It needs to be disseminated widely throughout all sectors of our nursing profession. Schools should also expand community learning experiences. And I know that we've been really trying that quite desperately over the last several years. Substantive education in the community, such as schools, workplaces, home health care, public health clinics, and telework settings, allow nursing students to learn about the broad range of care environments and to work collaboratively with other health and non-health professionals. And I'm talking about people from those other sectors again. Students need to actively engage in experiences that will expand and diversify their understanding of nursing practice, prepare them to care for diverse populations with empathy, and allow them to build the necessary skills and competencies to advance health equity. Next slide. Nurses need to feel healthy, well, and supported in order to care for people and to advance health equity. We know that. Addressing issues of health equity is really, really, really hard work. And unless we feel healthy and well, it's just not going to work. But the pandemic, as we know, has taken an unprecedented toll on the nursing workforce. Before the pandemic, many frontline nurses were understaffed, overworked, and burned out. Many worried about bullying and violence in the workplace. Many also care for children or elderly relatives outside of work. Their stresses have been exacerbated by COVID-19. Next slide, please. For over a year, nurses have risked their lives to care for others. They've cared for multiple critically ill patients at once and served as additional support when their families couldn't be physically present. They've used their own iPads to set up calls between patients and family members to say goodbye, and then they've stayed with their patients so that they didn't have to die alone. Other nurses have quickly moved floors and have had to rapidly adapt to caring for large numbers of COVID-19 patients, often without adequate training. We know that to be true. Nurses are working long shifts, sometimes without the personal protective equipment, although I hope that certainly is not the case anymore. It certainly was in the beginning. Over 550 nurses have lost their lives to COVID, a disproportionate of whom have been nurses of color. Some nurses who have spoken up to demand adequate protective equipment have lost their jobs, which is really an outrage. It's unbelievable. They've also faced stigma from the general public. When the workforce has been through is unjust and unsustainable. One of the main imperatives from an ethical advocacy and policy standpoint in the next decade will be to improve nurse well-being so that nurses will be able to provide high quality, safe care and to continue to care for patients, families, and communities in the way that they want to do it. That includes tackling the systems, structures, and policies that create workplace hazards and stresses that lead to burnout, fatigue, poor physical and mental health among the nursing workforce. Next slide, please. To fully support nurses, we also need to address and eliminate racism in our workplaces. Nurses of color repeatedly report experiencing discrimination and bias within their work settings. All nurses need to create a culture of equity in their workplaces. Nursing leaders have a particularly responsibility to make sure this happens. Our workplaces should reflect the patient population that we serve, and everyone should practice cultural humility and be aware of their biases. Our workplaces need to recruit, retain, mentor, and promote nurses from unrepresented backgrounds, and we need to advance nurses of color to leadership positions where they are sorely underrepresented. Next slide, please. The report includes a number of recommendations to fully support nurses. The main one is that by 2021, nursing education programs, employers, nursing leaders, licensing boards, and nursing organizations should initiate the implementation of structures, systems, and evidence-based interventions to promote nurses' health and well-being, especially as they take on new roles to advance health equity. Nursing education programs, for example, can integrate content on nursing's health and well-being into their programs to raise their students' awareness of their importance and provide them with training and support as they transition to practice. And this mentoring from faculty along the lines of student wellness is really, really critical. Next slide. The report offers many additional ways for individual nurses to get involved in advancing nursing equity. For nurse educators, you can see some ideas on this slide. I'll let you read those for a minute while I take a drink. Okay, next slide, please. There are many ways that individual nurses in practice can get involved in advancing health equity, including more ideas on this slide. Model behaviors that promote a culture of diversity, get involved in advocacy, understand how drivers of health affect you and be aware of your biases, invest in your own physical and mental health, identify and disseminate best practices to ensure equitable health care services. Next slide, please. Nursing research is vital to advancing health equity. The report notes that strengthening and diversifying the nursing workforce of the future and fostering nurse well-being to enable nurses to advance health equity will require robust and rigorous evidence base. And the report calls on various government agencies and foundations to bring together representatives from nursing, public health, and healthcare to develop and support a research agenda. And I would say, in addition, folks from other sectors. And I'm going to mention something here too that's not on my slides. You might recall, excuse me, from the first report that we called upon schools of nursing to double the number of nursing doctors. Well, that particular goal was more than met by mounds. And that was mostly because of the DMP, which is great. We're really happy about that influx of DMPs. But the committee noted again that building capacity in the PhD programs is sorely needed. So you'll see recommendations around, again, building capacity in that PhD realm. Next slide, please. Answering the call. The next decade offers tremendous challenges and opportunities for the nursing profession. More than ever, we need to tap the full potential of all nurses in every setting so that we can achieve what our country needs for everyone, no matter who they are or where they live, to be able to experience good health and well-being. New and established leaders at all levels and in all settings are needed to lead change that results in meeting social needs, addressing the social and economic drivers of health, and ultimately achieving health equity. So my hope is that many of you will answer the call. I hope that all of you actually will answer the call to create a world where everyone can experience the best possible health and well-being. And last slide, thank you. And I am very happy to have further discussion with you and answer your questions.
Thank you, Dr. Hassmiller, for a wonderful presentation. It's great to really hear the recommendations and your perspective on the report. I'm pleased now to open our session up with questions that we received ahead of time and some that are in the chat. And I think I want to begin with, given your role on both the 2011 report and where we are now, what excites you the most about the 2020-2030 report? And then, is there a particular initiative that you think will have the most meaningful impact on health and health equity?
Yeah, I think the thing that I'm most excited about is that, the more that we drill down with the disparities in our country, I mean, we see all of our indicators in this country are all going in the wrong direction. Life expectancy, quality of care, and it's really unfathomable in the richest country in the world that we could have such poor outcomes. And so we know that. A lot of people know that. Physicians, social workers, health professionals, people working in the field of social determinants and health equity. We know that, and a lot of people have been stepping forward, as we know, in the last couple of years, in particular, to work on these issues. And what excites me the most is the potential that I see in nurses. I do not want to. I do not want to see nurses left behind. I truly, truly believe that nurses can help lead the charge in addressing health equity, not on their own, but we can't be left behind. So that's what really excites me the most. And you asked another question, what will make the most difference? I'll say the pat answer, which is, how about the whole report? There are many recommendations that will make a lot of difference. And what I'm asking people to do, this came about in the first report too, Dr. Scott, and that is institutions, individuals and institutions should take this report now. This was a snapshot, a blueprint of recommendations made based on evidence in one point in time. And all recommendations made had to be supported by evidence. So some people will say, well, why didn't you recommend this? Or why didn't you recommend that? And it's because they had to be supported by evidence. So what I'm encouraging people to do, people who say, well, you should have made other recommendations, take the report to your institution, have vibrant discussions about it, pick it apart, and see what makes sense for you. If you're a state, for example, that needs to still pass scope of practice legislation, maybe that's something for you. If you're in education, you know that those education recommendations and ensuring that these concepts go across the curriculum, not just segregated and isolated in a particular public health course, that will make sense to you. Your question, it really depends on who you are and the institution that you work with. I guess another one I would add to that is, and I emphasized it when I was speaking to you, and that is really becoming comfortable with other sectors. I think we're very comfortable working in hospital settings and sometimes community settings with folks from other professions. And then we leave those other sectors to other people, such as social workers, very important people, social workers. But we need to get comfortable with that as well. And I would say, how do you do that? How do you get comfortable? One of the ways I find is that, through volunteer work. There are a lot of organizations in the community that are making decisions about a person's health. Maybe they're, food security organizations, maybe they're in transportation, but they're making decisions about health without anybody on their boards or their advisory committees that know anything about health. So this is a prime time in our history, in nursing's history, to really get involved in that way. Lillian Wald, the mother of public health nursing, she knew firsthand in New York City, the Henry Street settlement, that the people that she cared for and the nurses who worked with her, they knew that their people in their community would never be as healthy as possible until the dads, and it was the dads at the time, the dads had jobs, or the mothers had the support they needed for childcare, or children were being educated. So Lillian Wald and others knew firsthand how important those other determinants were. And as a nurse, she integrated all of that into her practice. I'm saying let's bring all that back.
Great. Thank you, Sue. There are some related questions about the organization and acute care and how to sort of shift the paradigm, if you will, in organizations to help them move forward on seeing the value of nursing practice, the value of evidence-based interventions, and how to move nurses off of one balance sheet to being really reflective of the value that they actually bring to the organization. So
well, you have a couple of things. You have a couple of things mixed in there. So let me get one thing at a time here. And while I'm talking and answering this, I really want to ask the audience too, of everything that I said. I know that people have not had a chance to look at the report yet so much. But what of what I said really resonated with you? What are you going to try to remember? What resonated with you? I'd like to hear some comments from the audience. And while I said that, let me see. I'm going to ask you to repeat your question again. Oh, I do. The acute care. Okay, I remember. So, how do we get acute care nurses? We know that public health nurses, we know that school nurses, nurses in federally qualified health centers, they deal on a daily basis with people and families and those social determinants, and they're used to working in that space. So we made a site visit. Excuse me. We made a site visit. The committee and I made a site visit 2 summers ago when we were able to be out and about. I'll use Rush, the Rush Health System as an example. At the Rush Health System, they have now incorporated into their electronic health record a series of questions that are asked of every single person coming into their system, whether it's a self-referral, whether it's through the emergency room, no matter how a person gets into the Rush system, they are asked about their social needs and their social determinants. And so nurses, every nurse has the opportunity to ask patients and clients about these things. And with the flick of a switch, if a person is known to be food insecure, a nurse just has to push that button, a red flag occurs, and then resources are put in place so that it's really a joint effort between IT and nursing and the other resources that are then brought to bear. And interestingly, at the Rush system, there were so many people they found that were food insecure that nursing took it upon itself to put a program together that when a person had a special flag next to the food security question, upon discharge, they were given, some bags of groceries. Now, is that going to solve the hunger issues in Chicago? No, that is meeting a social need and not addressing the upstream policies, if you will. More needs to be done about the upstream policies. But I was very proud of the nursing profession at Rush to have taken this on. And they're in the community working with food kitchens and food pantries as well. So nursing really took this on full force. So that's an example.
Mhm. Thank you, Sue. So there are a couple of questions again about financially acknowledging the role and value of nurses and nursing interventions. And I think that's where I was trying to go with part of that last question was how do we shift the C-suite in institutions as well as other payers to recognize the contribution of nurses?
So this is a bigger issue than nursing can take on themselves. I think until we get to a value-based system with accountable care organizations where all providers are valued and care and outcomes are based on truly outcomes and efficiencies and cost and time and system. So until we get to a fully, value-driven system, we're not going to get there. So what does that mean? Nurses have to be advocates of this kind of system. In the meantime, that's why I mention the National Nurse Identifier. Because right now, as we all know, people in the nursing profession and administrators, we know that nursing services are bundled in with hospital costs, and there's no way of pulling nursing out to value per se what they do, and likewise, it doesn't hold nursing very accountable for the care they give as well. So until we move to a more value-based system, and we can adopt this nurse identifier system right away, we're just really not going to get there to where we need to be.
Okay, great. Thank you, Sue. There are some questions about, again, from nursing education. Why don't I go there first? Some are asking about the intersection of the report and with the new AACN Essentials, and where do you see the report aligning with it?
So I think it does align. And, I think the AACN Essentials does call for nurses addressing certainly cultural humility and structural racism and health equity. So I think it aligns very well. I think now it's up to schools of nursing. This is what I meant when I said you need to take this report now and make it your own and see what's going to work for you and see what you want to work on. That's really the most important. And I would advise that for the essentials as well, compare and contrast, bring that, make that a point of discussion, Dr. Scott, in faculty meetings and, see where you land.
Okay. Great, thank you. I do want to touch a little bit on the research agenda. You mentioned the need for a robust one, and this is another two-part question. First, can you speak to the role of research equity and inclusive research in understanding and addressing disparities and contributing to health equity? And then there's another
Let me take that
question.
one first. Let me take one
Okay.
at a time. You got to remember my age here. So, so I think I think you have to approach it from a couple of angles. One is that we certainly need more research. And that's why the committee called for more capacity with and an increase in PhDs. And I know that we've been trying to do that, but we need even more capacity and more numbers in those PhD ranks. And while we have them, we need to really encourage our PhD students, certainly our DMP students as well, but our PhD students to do research, discovery and science around issues that relate to health equity and disparities.
Mhm.
So that's one thing. And then we need I'm going to talk about the diversity of the workforce as well. We need certainly more diversity among the ranks of PhDs and DMPs. I made mention of the fact that the higher we get up in educational ranks in our profession, the less white we are. So really paying attention to bringing in, recruiting, um, um, uh, young men or middle-aged, whatever, men and women of color into our programs, and then encouraging them to work on issues of disparities.
What would you suggest as the most important aspects of nurse well-being to study related to creating resilience
The most important thing
for research related to
well,
creating resilience?
I think, okay, so this is a big one. And we have to keep doing this. What works?
Mhm.
What works? And then getting out the message about what works. If I've heard it once, I've heard it 20 times or a million times, that health systems are still, I just heard the other day in fact, for Nurses Week, this is Nurses Day, Nurses Week, right? That a health system was giving away like goodie bags with granola bars and water and "We love you, nurse" sticker in it. Does that work? They tell me it doesn't. So, so I think we have to really understand what works for a nurse's well-being. We know from research that the work environment is really, really important. Staffing is really, really important. We know that supporting each other, really getting a handle on bullying and violence, not only lateral violence, but interprofessional violence, bullying, and from patients as well. So we have packages of what we understand, but putting them together and then saying unequivocally, following 1 through 5, this is what works, and this is what's going to keep your nurses healthy and well. The committee found, as we know too, that I'll just say the future is here. It's just not everywhere. So what I mean by that is that some health systems have it figured out. So I'll mention one in particular. Some health systems haven't figured it out, but in order to really create well-being among the masses, you have to disseminate and replicate and get those best practices out. So, for example, one thing that we found really works, especially during COVID and the pandemic, were peer support groups. Peer support groups, giving nurses the time and space to talk and vent and cry and encourage with one another. But look, that's hearsay. I heard that works. I heard from nurses that made them feel valued. Has there been research on that? Yeah.
Great. Well, thank you. There is a diversity question that says many faculty believe that doing diversity means building an inclusive classroom, but struggle with their knowledge of the racism in the United States. What recommendations do you have for closing that gap?
Well, I will say that we are used to hearing, as you said, we're used to hearing about diversity and the need to increase diversity among our nurses. Structural racism within nursing, I would say that it's new for a lot of people. It's not new for some people, as we know. It's new for a whole lot of other people, as we know. So what does that mean? It means that we have to get used to talking about it. It means that we have to recognize that it's there. It means that we have to understand how it plays out structurally in the institutions where we work or where we get educated. And it means, I will just add this. This is me.
Mm-hmm.
It means that we have to be patient with one another. It is time to take action, but conversations need to happen, and some people don't want to talk about it. Some people are afraid to say the wrong thing, as we know, right? And so we have to be open with one another and encourage one another and just be humble. And in the spirit of humility, say, I don't know this. Can you help me? Or gently, I don't want to say admonishing, but gently making observations, helping other people see what they may have said or what they have done could have been done in another way. So we can't be rude or crude or belligerent with one another. I think in the nursing profession, we're known for our care. We do need to take action, and we do need to dismantle racial, injustices. But there are ways of doing it.
Okay.
This is me talking.
Yes. Okay. Well, my advanced practice colleagues would be not happy with me if I didn't ask you a question about scope of practice, especially given where we are in Wisconsin as a restricted state. Are there any actions being taken at the national level that could facilitate changes in those 27 states that are still restricted or reduced?
So here's one thing, and I don't know where Wisconsin stands with this, but we make the committee makes a big recommendation in the report that says that all the lifting of all scope of practice barriers during COVID-19 need to be made permanent, must be made permanent. And I don't know where Wisconsin is in that, whether your state lifted barriers during COVID. If it is one of those states, then the answer to your question is yes. Then we have made that recommendation, and that's coming from the national level. But of course, so many of these scope of practice barriers are not just state, but they're institutional, right? They're institutional. So institutions need to sort of identify. So I'm on the board of a big health system in New Jersey, and I'm very proud of what they did. I'm gonna name this system because this is the good news. So I'm on the board of Hackensack Meridian in New Jersey. What they did after COVID has not ended, granted, But what they did over the last couple of months, they came out with a report on um, on how they identified things that went on in their system because of COVID. Maybe it's the lifting of barriers. Maybe it's a relaxation of standards. But there's a whole book, and it's public now. But it's sort of a book on learning from not from our mistakes, but learning from COVID about the good news, what we did that worked that we don't want to go backwards on. So they have a whole list of things that they did during COVID that they're not going to go back on because it created actually more efficiencies, better quality of care, better access. Okay.
Mm-hmm.
So that's what I would recommend, and what's being done at the national level. Let me say a couple more things about that. So these scope of practice barriers, as everyone knows, are legislated at the state level. Okay, they're legislated at the state level. So is there some kind of a national sort of magic wand that can sort of make all these states do what we think they should do? Not really. It has to be done at a state level. We know that in 2016, the Veterans Administration lifted scope of practice barriers for all of their advanced practice nurses. So they were able to do that because they're a national system. Okay.
Mm-hmm.
Now, the Campaign for Action, the campaign that I direct, the Future of Nursing Campaign for Action, we do a lot of work. If a state is in need of help at the state level, we can come in, we can help. We've helped many states. Remember, the Future of Nursing Campaign for Action is a collaboration between Robert Wood Johnson Foundation and AARP.
Mm-hmm.
What is AARP? It's the world's largest consumer organization. And they are absolutely 500% supportive of states lifting these barriers. So as an entity, we have an advocacy director who's part-time with the campaign and part-time with AARP, who oversees these legislative efforts in states around scope of practice. So that's happening at the national level. That's a very long-winded answer about all of this, but hopefully you got a little bit of nibbles here and there about it.
Yes. Well, thank you, Sue. In our final couple minutes, do you have any take-home message that you want our audience to walk away and ponder? I know that you talked about getting the report, dissecting it, having those conversations. Any other recommendations that you think would be appropriate first steps or priorities that we should be doing?
Well, there's a lot of recommendations, and again, you have to sort of make it your own. I would say an overarching recommendation would be on the issue of racial discrimination and other inequities, whether it's disabilities or living in rural areas. We can't be nurses without really understanding those issues. So I would admonish, encourage, ask, beg all nurses to really understand that this is the issue of our time. And if this is the issue of our time in healthcare and outside of healthcare, right? If this is the issue of our time, then I really want nurses to be front and center on this issue. What does it mean to be front and center? What does it mean to help take the lead in this? Well, you have to understand. You have to understand the disparities, the graphs, where our outcomes are not shoring up according to in comparison with other countries. So we need to understand where we are. We need to understand where the gaps are and where we need to get to. and be comfortable with talking about it, working with other sectors. And that's sort of my overarching. Other than that, all these other recommendations filling the report are sort of meat on those bones.
Mhm. Thank you, Sue. So I would like to thank everyone for joining us this evening and providing thoughtful questions around these very important topics. Collectively, this audience represents the breadth of perspectives and roles it will take to act in response to the Future of Nursing 2020-2030 key recommendations to strengthen the nursing profession to meet the challenges of the upcoming decade. So, Dr. Hassmiller, Sue, I want to thank you again for the commitment you made when I asked you 2 years ago
Yeah, that's right.
to be here to present to the School of Nursing on the Future of Nursing report after its release. And yes, I was pretty persistent, and you were very, very open to letting me do that.
That's right. That's right. You had to be first out of the gate. Wisconsin, #1 in the country.
That's right. I knew it would be special to immerse in this information together as a Badger nurse community. I envisioned that it would be productive and unifying to share with our many partners across nursing and other health professions. Now it is clear what a gift this has been to hear your presentation together. It is truly inspiring to consider the conviction we share and the collective impact that we will have in charting a path to health equity. Sue, I also want to say that your leadership in bringing the committee's report to fruition is exemplary. I would like to share with our audience that the School of Nursing has chosen to recognize you as a part of our Honor a Nurse initiative in appreciation for your time and expertise tonight, and in gratitude for the vast contributions you have made to the nursing profession and healthcare. Among other things, you have not only led the campaign for change, you have been instrumental to building the foundations from which change is possible. So please accept my sincere appreciation on behalf of the faculty, staff, students, alumni, and partners of the UW-Madison School of Nursing.
Thank you so much. Thank you so much. I so appreciate being here and doing this for you first and foremost. And thank you for your patience as I got my feet wet with the new material.
Okay. Oh, well, wonderful presentation. So thank you again. Many of the greatest challenges faced by individuals, families, communities, and populations intersect with health and healthcare. It is daunting to consider the complex needs that must be met in the future of nursing. Yet it is hopeful to know that we will move ahead in addressing them with a shared understanding of what it will take to advance health for all and provide equitable care. The School of Nursing is deeply committed to fulfilling our potential as leaders in nursing education, research, and practice. So tonight, I am delighted to make the first public announcement that the School of Nursing will seek significant funding through a 3-year fundraising campaign as we approach our centennial year in 2024. This major philanthropic endeavor, called the Badger Nurses Change Lives campaign, will allow us to align our efforts and resources to meet the health needs of changing and aging populations and to transform health systems to deliver more equitable care. We are launching this fundraising effort because we need your support to maximize our impact and contribute all we can to building more equitable healthcare and systems of care. These are critical to a just society. Within each of our pillars of our campaign, there is an opportunity for the School of Nursing to lead the way in shaping nursing research, education, practice, and policies to protect and improve health for all. As you learn more about the Badger Nurses Change Lives campaign, you will see a focus on building health equity through all facets of nursing education. These efforts must include strategies and significant funding to remove the financial barriers we face in doing so. I am pleased to share that we have recently received a lead gift from the Oscar Rennebaum Foundation. This gift is dedicated to supporting our efforts to build health equity through nursing education. We will now be joined by Mary Jo Branson, representing the Oscar Rennebaum Foundation Board of Directors. Mary joins us tonight to announce a commitment that has been made in support of the school's efforts to build nurse workforce diversity and health equity. Mary, welcome. Nurse workforce diversity and health equity. Mary, welcome.
Thank you, Linda.
Nurse workforce diversity and health equity.
It is a
Mary,
pleasure
welcome.
to be. It is a pleasure to be here and to represent the Oscar Rennebaum Foundation Board of Directors in making this announcement of our support. The Oscar Rennebaum Foundation invests in people and programs that reflect the optimism, enthusiasm, and civil obligation demonstrated by Oscar Rennebaum. Among its many contributions, Rennebaum Foundation support enhances access to education, research, and teaching and human resources in order to improve the quality of life for everyone in the Madison community. Not only is the Oscar Rennebaum Foundation compelled by the vision of a more equitable healthcare system, we believe in the potential for the University of Wisconsin-Madison School of Nursing to lead in this important effort. On behalf of the Oscar Rennebaum Foundation, I am proud to announce a $500,000 gift to the school to create the Rennebaum Initiative for Nurse Workforce Diversity and Health Equity. Through this gift, we are providing funding for the School of Nursing in making meaningful progress toward building health equity through nursing education. This initiative is focused on removing financial barriers to a more diverse faculty and student body. It is aligned with the strength and vision of the School of Nursing and the mission of the Oscar Rennebaum Foundation. The Rennebaum Foundation is truly pleased and proud to make this gift. It is our hope that we may also inspire others to support the School of Nursing, whether it is through your contributions as individuals or by prompting support from organizations with which you are affiliated. Your support of the Badger Nurses Change Lives campaign will move the School of Nursing forward in its aspiration to improve health for all. I would like to thank Dr. Hassmiller for presenting on the recommendations for the future of nursing. The Rennebaum Foundation is delighted to contribute to making these recommendations a reality. And Dean Scott, I want to acknowledge your leadership at the School of Nursing and more widely in the profession. We are confident that our investment in the School of Nursing will make a meaningful impact. The Oscar Rennebaum Foundation's Board of Directors are pleased to support the next generation of nurse leaders.
Thank you, Mary. And thank you to the Board of Directors of the Oscar Rennebaum Foundation for your support of the School of Nursing through this gift and the many contributions that improve the quality of life for the Madison community and the state of Wisconsin. So thank you again. It is now time to bring this event to a close. Once again, I'd like to thank our audience members for joining us and providing thoughtful questions. Before I say goodnight, I would like to thank the members of the School of Nursing faculty and staff for planning, attending, and sharing this event as an important part of our mission to develop nurse leaders for the profession and society. I also thank the members of our Board of Visitors for their support of School of Nursing initiatives and for the guidance and insight they provide. I am grateful to the service of these board members and their deep belief that the school can and must lead in building health equity. It has been my honor to host this event at the UW-Madison School of Nursing and to share it with so many of you. If you would like to view this recorded event or recommend it to others, it will be available at the School of Nursing website on May 21st. I hope you will also consider visiting our Badger Nurses Change Lives website to support and learn more about our campaign. Thank you for joining us for the recommendations for the future of nursing. I would like to say good night and take care. And although we have individuals from all across the United States with us, I will still say, as always, on Wisconsin. Good night.